All right. Hello. My name is Kimberly, and I'm going to do a head to toe assessment today. Can you tell me your name and date of birth?
Tory Green,
Okay. What's your date of birth?
July 8th, 1991.
Okay. Before I proceed, I will wash my hands and then I'll come back. Okay. So, how are you doing today?
Good.
Okay. The first thing I would do is get his vital signs. I would get his temperature, I would get his pulse, his respirations, his blood pressure, and I will also do a O2 sat on him. Okay. So from 0 to 10, how would you rate your pain?
0.
Okay, 0. Okay. So the next thing I want to do is let's pull this over, just the hair. Okay. All right. So I want to start with the head. So I would check his hair for distribution, the texture of it, the looks for any bruises, lumps, scars. Check for tenderness when I touch it. Okay. So there's none. Do you have any pain? Okay. So the next thing I want to do is check his face. So we're gonna do some little facial muscles. Okay. Raise your eyes for me. Squint your eyebrows. Okay. And his eyebrows are symmetrical. They're both even when he raises eyebrows. Squint your eyes up tight for me. They both squinch. Okay. All right. Now make a smile for me. Frown. Okay. All of his nerves are intact, so that will be cranial nerve number 7. Okay. Next thing I will do is, let's see, we're gonna do the sensation. All right. I'm gonna have you to close your eyes and you tell me when you can feel this. Okay. All right. Okay. All right. So his sensation is intact. All right. Can I get you to stick your tongue out for me? All right. How about puff your cheeks? Okay. Now let's. Okay, we did the light sensation. Okay. The next thing I want to do is look at his eyes, the external part of his eyes. Okay. So they're even. They're symmetrical. No deviation, both sides. His eyelashes are even. Told you about that. Palpable folds. If I palpated, I'm looking for feeling for any tenderness. Next thing you want to see is the sclera. His sclera is white. I will look at his conjunctival sac by pulling his eyelids at the bottom down, and on both sides, so that would be pink. Or I don't see any drainage in his eyes. Do you wear glasses? Do you have any pain in your eyes? Okay. All right. So, and I will look at his iris. The color of his iris is chestnut brown. Okay. The next thing I would do is do a near vision with my Rosenberg chart. Okay. So what I want to do is get you to, and this is checking for cranial nerve number 2. So I want you to hold the card on the left eye. Well, I can hold it for you. All right. Well, you got to tell me when you hold that one. And you tell me, hold it over your eye for me, and tell me when you see my finger, your fingers, my fingers. You see? Okay. Now do the opposite side. And what I'm doing is checking for peripheral vision. Okay. Tell me when you see my fingers. Okay. Now take the card down. Tell me when you see your fingers. All right. So now I'm gonna get you to read the number, the lastest number you can see across the top there.
3748.
Okay, 3748. Okay, so he can see the so cranial nerve number 2. He can see peripheral vision, and we was able to do the Rosenberg chart. Good. So the next thing I want to do is the coronal reflex. And so the coronal reflex, I'm gonna shine this light in his eye, and I'm gonna shine it into his pupil. The light should shine back from the pupil, and it should be a red orange glow color. And I'm gonna do it on both sides. So I'll put my left eye over his left eye. All right. If it's not red and orange and glowing, that means his retina is detached. And I would do it on the opposite side with my opposite hand. All right. Now look. Okay, everything is intact. All right, so the next thing that I would do is I'm gonna look at his nose. His nose is symmetry, it's symmetrical, no deviated septum. I would look inside of his nose first. All right. Put my little thing on here. Right. All right. So can I get you to hold your head back for me? All right. So I'm gonna look at his turbinates. I'm looking to see if the septum is not deviated. I don't see any crusty stuff. Everything's good. Now, if I was testing his smell, I would have him to press down on one nostril, have him smell it, have his eyes closed and tell me what he smelled. I would have him to do it on the opposite side as well. Whatever you do on one side, you have to do on the other. The next thing that I would do is look into his ears. And so I would pull the ear, top of the ear up and back. And I'm looking for the pearly gray ear canal. I will go on the opposite side. All right. Olfactory, not olfactory, but it's cranial nerve number 8. All right. So the next thing I'll do is see whether or not he can hear on both sides. I will whisper a couple of things in his ears and have him to repeat it. Okay. I'm gonna say something in your ear. Tell me what I say.
1, 2, 3. 8, 9, 10.
Okay. The next thing I want to do is talk about his skin. His skin is moist, it's warm. I don't see any bruises or cuts. I'm gonna go to his hair is evenly distributed on his face. He has a mustache and a beard. His lips are pink and moist. Have him to open his mouth for me. Open your mouth for me. All right. So I'm looking on the inside. I'm looking at keep it open for me. I'm looking at the buccal mucosa. I'm looking at his teeth distribution. I'm looking at his tongue. I'm looking at the heart palate. Lift your tongue up for me. All right, and looking at the bottom palate, the soft palate. Everything is pink and moist and intact. I didn't see any lesions or bruises. Okay, so the next thing I want to do is check the range of motion in his head. So Tori, if you could follow me, put your head on your shoulder. On your chest, and then back up. Head back to the midline, to the side, to the left side, to the right side. Go to the right side, your left side now. Okay, straight ahead. All right, put your ear to the shoulder. Do the opposite side. All right. Did you have any pain? Okay. So that means his range of motion is intact. Okay. So the next thing I want to do is check his trachea and his thyroid. And the way I will do that is I'll have him to hold his head back, and I will have one hand pushing in and over. Have him to swallow for me. Okay. All right. So his trachea is midline. Look, while he's sitting up, I don't see any jugular neck veins distension on either side. I'm looking at it. If he did have some, there would be something going on with his heart, but he's not doing that. I would feel for his carotids on both sides at one time. So I do feel the carotid on one side and I feel the carotid on the other. Okay, so now we're done with the head. The next thing that I would do is I'm going to go down to his lungs now. So I'm looking at his posture. His posture is upright. His respiratory rate look like he's not making any extra effort, like using accessory muscles to breathe. He has good lung expansion. The depth of it looks good. And the pattern, everything's good right there. All right, so the next thing I want to do is palpate. I want to palpate on his chest. I will palpate to feel for any tenderness, and so any crepiness or anything like that. And I will also do it, whatever I do in the front, I will do to the posterior area as well. The next thing that I want to do is to add listening to his lungs. So, get my stethoscope here. I'm going to listen to his upper and lower lobes on the left side and on the right side. All right, deep breath in and out. All right, I'm in the second intercostal space. I'll go to the next side. Okay, breathe in and out for me. Breathe in and out. Breathe in and out. Breathe in and out. Okay, so I listened to it. I didn't hear any, it was clear, no wheezing, no crackles. Whatever I do in the front, I will do in the back posteriorly. So I will listen, deep breath in and out, deep breath in and out. And I'm making sure that I'm not on the scapula. Deep breath in and out, deep breath in and out, deep breath in and out. Also, since I'm in the back, I'm going to check the scapular borderlines. Okay. All right. I feel the scapula. It's midline. Everything's intact. Now, the next thing I want to do is do his heart. So I'm going to listen to his heart sounds, okay? This is his aorta. The aorta is in the second intercostal space on the right side. And I'm listening to it with the bell of the stethoscope. Okay, I'm going to move over to the pulmonic, and I'm listening to the bell. It's in the second intercostal space. The Erb's point is in the fourth intercostal space. The apical pulse is mid-clavicular line, fifth intercostal space. And I'm hearing a lub-dub, no extra sounds in my hearing. Also, with the apical pulse, you want to listen for 1 full minute. Okay, so now I will have Tori to lay down, but we don't have a bed, so I'm not going to have him lay down. And I will listen. What now will assess his abdominal area. So when I look at his abdominal area, I'm gonna look at his contour of his stomach. I'm looking for any lesions. I'm looking to see if I see any masses or any hernias, anything like that. And then once I look at it, then I'm gonna listen. I'm listening. I cut the stomach in 4 parts, and I'm listening to each quad. I'm listening for gurgles and clicks. It could be regular. It could be hypo. It could be normal, hypo, or hyper. If it's hypo, that might be because he just came from surgery, or he might have ileus, or if it's hyper, he might have a lot of gas. Okay, so the next thing, but before I palpate, I would do the percussing. So I would percuss. I would put my finger in each quad. And so I'm listening for tympany. Tympany is airfield. If it's dull sounds, that means that it's an organ that I'm feeling, or it might be some fluid there. Okay, so the next thing I would do is palpation. I would do a light palpation, which is superficial, and I'm feeling for masses, anything like that underneath superficially. Then I would do a deep palpation. When I do the deep palpation, I'm feeling for the spleen. The spleen is on the right side, underneath the rib cage, and on the left side, you feel the liver. That's on the opposite side. Okay, next, what I want to do is check his abdomen area. The abdomen, I'm going to check for appendicitis. So for appendicitis, hold on a second, let me put that over here. We have the illicit Bronsberg, and so how you would check that is I would have him to lay down, and I will put my hand straight down on the side of his stomach here on the left side. And when I push straight down when he's lying down, if he have any pain, that means that he does have appendicitis. The other one that how I would check for appendicitis is arbitrary. So the arbitrary, I would have him to lay down. I would have him to raise his right leg up to meet resistance to my hand. The next one is a different one. It's when the Bronsberg, or it's called the saddle signs. It's called SOAD sign. That's what it is. So with the SOAD sign, the SOAD sign is the one which you do with your knee. You have them to push down. I'll push down his knee and he'll push up. In the arbitrary, I will put my hand on his hip, and I would bend his knee. I have him to turn on his left side, and I will put my hand on his upper right hip, and I would have him to bend his knee, and I would turn it in rotation. If he have any pain, that means that he does have appendicitis. Okay, so the next thing that I would do is we're gonna do the range of motion. Okay, so let me get you to hold your arms up for me. And I'm going to check his tricep muscle, and we're going to check his biceps. So when I pull back, have him to push up, pull, keep me from, okay. So his biceps are intact, and then have him to push back, and then that was his triceps, and they're intact. Have him to squeeze my fingers, okay. Strong, 5 out of 5 with strength. Okay, I want to check his circulation and his fingers. Okay, so I would get his finger, I would push down on the nail bed, push down. If it's white, when I take my finger away, it should turn back pink. And I would do that with each finger. And that's showing that he's got good circulation. For hydration, I would check his skin to see if it could bounce back. I would pinch the back of his hand. If it goes back, then that means he does have good hydration. Okay, so after we do that, I did the abdomen, I did that. Okay, so we're gonna stand up now and get you to bend over for me. Okay, and then touch his toes. So I'm checking for his spine, and it's straight. It's not, I'm looking for any type of curvatures. Okay, you can stand back up. All right, you can sit back down. I do want to check his lymph nodes. Okay, so with his lymph nodes, I'm gonna go in front of the ear. This aerial, and then behind will be the posterior part of the lymph node. Then the chain, you got the submandibular, you got the submendo. Then when you turn your head, can you turn your head for me? Do the opposite side. Down at the chain, this will be the chain right here with the lymph nodes. But you would have to feel deep when you're feeling the chain on his neck. The clavicle is like right above the clavicle on the side right there. So that would be the superficial clavicle, the posterior clavicle, the deep cervical, and I'm listening and feeling for the supral clavicle. All right, so we did the heart sounds. I did my lungs, I did my abdomen. So the next thing I want to do is his extremities. So with his extremities, I will look at the contour of his extremities. I will check the muscle strength. I will have him to raise his leg and push against my resistance on both sides. I will have him to push back on my hands to check the muscles of both of his legs on both sides. Also, I would check his pulses. I would check his radial pulses, and it should be a pulse of 2. I would check his popliteal, that's behind the knee. I would check his tibia, which is on the inside of the ankle. I would check his dorsal, that would be on top of his foot. He has temporal that are on the side right here. Also, I would like to go back because I didn't do his TMJ. I hope that don't be taken off, but I need to do his TMJ. All right, so his TMJ, can I have you to open your mouth for me? Close it. I didn't feel any clicks. Did you have any pain? Okay, sorry about that. Okay, so the next thing that I would do is do the dorsal with his foot, checking for muscle strength in his feet. So I will have him to do the plantar. Plantar is when I have him to push on the gas. And if he can move his feet, then his strength is good. 5 out of 5. Push back, that's dorsal, okay? All right, so now I'm gonna check when he stand. Can I get you to stand? I wanna check, okay, when he ambulate, I wanna make sure that he's walking straight and not limping. So I get you to walk to the door and come back, please. Okay, can you come back? All right, you can sit down. Next thing I want to do is check his biceps. I want to check his flexion. Yeah. All right, so I'm going to check his bicep flexion. And hold your arm up for me. And I'm going to hit my thumb, and his hand, it should flex. And it did. All right, I would do the opposite side. And I would put my thumb here, and I would hit. All right, and the arm would flex. Also, I would do the bottom of his knee, hit, and the leg would shoot out. Hit this leg, it'll hit out. All right, next I'm gonna check the neurological conduct on the upper extremities. So what I'll do is have him to touch his fingers. So I want you to touch your fingers just like this, okay? Feel sensation, okay? All right, so then I want you to hold your hand out like this and hold it up. Close your eyes for me. See if you can hold him up, okay? Turn him over, keep your eyes closed. There's no swaying, okay? So he's got good strength. All right, so I'd also want to do passive range of motion, all right? With his arms, I would take his arm and I would go in, that's in rotation. Outward, no, this is in rotation, so when you swing the arms. Abduction is adding. That's abduction. That's when you add. And adduction is out. So I would do the other side. When you're adding to the body, it's going toward the body. When you're coming out, there is abduction. I will also do the legs to see if I can have in rotation. Is when you bring your legs in. Out rotation is on his out. If he don't have any pain, that means that we're checking his joints. And so his joints are good. Did you have any pain when I did that? Okay, so I think that is going to cover everything today. Thank you for letting me do your assessment, and have a great day.